In order to get to the E. coli bacteria, we must see that when we were looking at the big picture gram-negative bacteria, we looked at the Cryptococci, which included Neisseria gonorrhea, Moraxella, Neisseria meningitis, and we looked at the Coxobacilli, which included Haemophilus influenza, Bordetella pertussis, Bacillella, and some others, and we looked at bacilli. Now, when we looked at bacilli, we either saw some of the non-lactose fermenters, which we've completed at this point. For the non-lactose fermenters, we were performing the oxidase test. Pseudomonas was positive. And for the ones that were negative on the oxidase test, we were performing the H2S production on triple sugar iron agar test, which basically differentiated Shigella and Yersinia, which were negative, which did not produce the H2S, and then the positive ones were Salmonella and Proteus, which were positive, which did produce the H2S on the triple sugar iron agar. Now we have the lactose fermenters. When we talk about the lactose fermenters, we basically have some fast fermenters and some slow fermenters. The fast ones include E. coli, Klebsiella, and Enterobacter. We will see E. coli and Klebsiella shortly. Basically, these produce optimum levels of both beta-galactosidase, the enzyme that splits the lactose, and permease, the transport protein that brings lactose into the bacterial cell. Since they have good levels of both these enzymes, they are fast fermenters. But the slow fermenters like Citrobacter and Serratia usually produce optimum levels only of beta-galactosidase, but suboptimal levels or sluggish levels of permease. Because lactose cannot enter the cell efficiently, it takes time, so they're slow fermenters to build up the threshold levels required to activate the hydrolysis process. Right? So let's talk about E. coli now. Okay, so when we talk about the E. coli, we identify the E. coli basically as a gram-negative rod, right? Also, it's indole positive. Now, what's indole positive? An indole positive test result indicates that a bacteria possesses the enzyme, which is tryptophanase, which allows it to break down the amino acid tryptophan into indole, pyruvic acid, and ammonia. This metabolic characteristic is widely used in labs to identify different waste microorganisms. So whenever we have a positive indole test, we know we're dealing with E. coli, and if it's negative, we know it's the Klebsiella or something else, right? So lab identification, by the way, in E. coli grows pink colonies on McConkeys agar. Why does it grow pink colonies? Because E. coli ferments lactose. We know that this is a lactose fermenter, right? And we know this is a fast lactose fermenter. Now, whenever you think of E. coli as having two personalities. There's one is the normal flora, which is the normal flora E. coli, which lives harmlessly in the colon. The other one is the pathogenic E. coli. This acquires virulence genes and causes diarrhea, UTIs, neonatal meningitis, and sepsis. So we have two kinds of E. coli in our body. The one is just in the normal flora E. coli, which normally lives in our colon. The other one is the pathogenic one, the one that causes diarrhea, UTIs, neonatal meningitis, and sepsis. Another thing, okay, so we've discussed that E. coli is indole positive and Klebsiella is indole negative. This is a classic Viva question. It's very tested on exams. Another mnemonic to remember the E. coli diseases is peep, poop, pee, poop, pus, pregnancy. I know it's funny, but it will help you remember. So pee, poop, pus, and pregnancy. P is basically for getting a UTI, poop is for diarrheal diseases, pus is for sepsis, and pregnancy means neonatal meningitis, right? Virulence factors. Now we have two virulence factors. One is the pili. The pili is basically the fibria, and this allows for attachment, especially in UTIs. Without this attachment, bacteria would simply be washed away, right? So the pili is very important. And then we have this K capsule. What this K capsule does is it prevents the E. coli from phagocytosis. So it's very important in neonatal meningitis. And then you also have this LPS endotoxin. Of course, this causes fever, shock, septicemia through the interleukin 1, 6, and TNF. Then we have E. coli pathotypes, right? So I told you that there are different types of E. coli, right? We basically saw there were two kinds of personality. Now, when we talk about pathogenic E. coli, we further have different types of E. coli, right? So the first one we're going to study is, I'm not going in the order of first aid. The first one we're going to study is the enterotoxigenic E. coli. And this is the most common cause of traveler's diarrhea. It's also called Montezuma's revenge. I don't know why, but that's also something that it's called. Okay, so this produces two toxins, the heat labile toxin and the heat stable enterotoxin, right? So what the heat labile toxin does is it activates the GS protein. So the heat labile toxin, what it does is this is an LT toxin, right? So this LT toxin basically works like cholera toxin. What it does is it activates the GS, right? Through activating the GS, it basically works on the adenylate cyclase, right? And that increases your CAMP. And once your CAMP is increased, you get chloride secretion, which leads to watery secretion and which leads to watery diarrhea. Now, how this happens is it basically activates the GS protein. That's something I want you guys to know. That's your heat labile toxin. And then we have an ST toxin. This ST toxin is an heat stable toxin. What this does is it activates the guanylate cyclase protein, right? So when it activates this, it leads to increased CGMP. This also leads to water secretion. So the result of both of these toxins is that you get watery diarrhea, but you have no blood and no invasion, right? Remember, so E-Tech is travel and toxins, right? Okay, so the next one is pathogenic E. coli. This is mostly found in infants. So the population that the enteropathogenic E. coli affects is infants, especially of developing countries. No toxin is produced. It adheres to apical surfaces, flattens the villi, and prevents absorption. So if something is flattening the villi of the intestine, what will happen is you are going to get a problem with absorbing the nutrients because you're flattening your villi. Since you're going to get a problem with absorption of nutrients, what are you going to get? You're going to get malabsorption. So since this enteropathogenic E. coli attaches to intestinal cells, it destroys microvilli. It's also known as attaching and effacing lesion. So the lesion of this one is called attaching and effacing lesion. You get diarrhea usually in children, you get malabsorption, right? So enteropathogenic E. coli, no mechanism. The mechanism is there is no toxin, no invasion. Instead, it attaches to enterocytes, destroys the microvilli, and leads to malabsorption, which leads to diarrhea. This is called attaching and effacing lesion. The villi become flattened. You get infant diarrhea, pediatric diarrhea in developing countries. Then we have the next type of E. coli, which is the enterohemorrhagic coli, right? So what is it in transmitted in? It's basically the sources like undercooked beef, hamburgers, raw vegetables, or unpasteurized products, right? Now memorize this serotype 015787. It's the most common serotype and it's very dangerous, right? And this enterohemorrhagic E. coli is very important also because it has a toxin called the Shiga-like toxin, right? So it has this Shiga-like toxin works just like the Shigella. It inhibits the 60S ribosome, which stops protein synthesis, right? Let's look at this. Now it produces the Shiga-like toxin, which is a beta toxin. The mechanism is the same as the Shigella toxin. It inactivates the 60S ribosome and the protein synthesis stops, which leads to cell death, right? Initially, you get watery diarrhea, but then you get bloody diarrhea, right? So clinical presentation, initially you get severe abdominal pain and then you get diarrhea with little or no fever. Now, fever is usually absent and that is a little clue for this kind of E015787 in hereditary coli. The major complication is hemolytic uremic syndrome. Now, what is hemolytic uremic syndrome? Basically, it's a syndrome where you get hemolytic anemia, you get thrombocytopenia, and you get acute kidney injury. Why do you get this basically? So basically, this causes endothelial injury, right? So microthrombi form, and that leads to RBCs getting sliced, which leads to schistocytes on peripheral smear. So you get hemolytic anemia because there's endothelial injury, microthrombi are forming, which are slicing the RBCs. You get thrombocytopenia along with it, right? And you get acute kidney injury due to microthrombi. So those microthrombi on the damaged epithelium also cause acute kidney injury, right? So the classic case is where you get a child with bloody diarrhea, and few days later the child will have renal failure. So you know you're working with an enterohemorrhagic E. coli. Antibiotics, you avoid antibiotics. Why do you avoid antibiotics? Because it can increase the toxin release in enterohemorrhagic E. coli. Then the last one that we're going to talk, which is actually the first kind of strain on first is the enteroinvasive E. coli. This also acts like the Shigella mechanism. It invades intestinal mucosa and causes inflammation, right? So it causes fever, abdominal pain, bloody diarrhea. Remember, enteroinvasive, it's basically invasive, right? That is something you should know. Okay, so we'll now move on to the next bacteria. Okay, so now we move on to Klebsiella. Now we know Klebsiella is basically indole negative. So that's how we know that a fast lactose fermenter is basically when it's indole negative, we know it's Klebsiella. Right? So it's a gram-negative rod, it's a lactose fermenter. It also grows pink colonies on the Mecanthus agar. It's oxidase negative, it's not motile, and it has a really large polysaccharide capsule. The capsule is the key to understanding Klebsiella. Right? If you understand the capsule, you understand Klebsiella. So why are the colonies so mucoid? Mucoid, you look at the big picture, we have shiny sticky colonies, and these shiny sticky colonies are due to a thick polysaccharide capsule, right? So think of Klebsiella as being wrapped in a giant mucus coat. This capsule, what it does is basically this capsule basically prevents phagocytosis, increases virulence, and produces the characteristic mucoid appearance, right? So a classic patient with a classic vignette will be like an alcoholic or diabetic who develops pneumonia. And so the alcoholic diabetic patient gets pneumonia. And why does this happen? Alcoholism decreases cough and gag reflexes. And there's aspiration of oral and gastric contents, which leads to Klebsiella entering the lungs, right? It's very, very common in aspiration pneumonia. So you look at this picture, those shiny, sticky colonies are due to the thick polysaccharide capsule. Think of Klebsiella as being wrapped in this giant mucus coat. The capsule prevents phagocytosis, increases virulence, produces the characteristic mucoid appearance. So an alcoholic or diabetic who develops pneumonia because alcoholism decreases cough and gag reflexes, and there is aspiration of oral gastric contents, which leads to Klebsiella entering the lungs. Now, aspiration pneumonia, what happens in this is basically normally aspiration pneumonia affects the right upper lobe, right? When you're supine, or supine means you're lying down, and it affects the right lower lobe when you're upright because the right main bronchus is more vertical. So Klebsiella is a very famous cause of aspiration. Now, what does it cause in the lungs? Klebsiella basically causes lobar pneumonia. The entire lung lobe becomes consolidated. Patients develop high fever, productive cough, dyspnea, and chest pain. Another very important clinical clue, which is so easy that I think it doesn't even appear anymore because it's so easy to guess. It gets this currant jelly sputum. This is the most famous clue. What is it? It's thick sputum containing blood mucus, inflammatory debris, which looks like red currant jelly. Hence, it's called currant jelly sputum. Klebsiella can cause lung abscesses because infection is highly destructive. It can also cause liver abscesses, especially in diabetics. The virulence factor I told you was the capsule. So virulence factor, the capsule is most important. It has a really big capsule, right? Big virulence. So it has a really big capsule. It's this virulence factor for this capsule is that it's antiphagocytic. It also can lead to immune invasion and mucoid colonies, right? It also has an endotoxin, which again leads to fever, septic shock, and inflammation. Now, it's seen in hospital-acquired infections. So, Klebsiella is a major cause of nosocomial UTIs, right? So, in catheterized patients or ICU patients, Klebsiella is very common to be the causing agent of UTIs. Also, it has some studied drug resistance. This is becoming increasingly important. Klebsiella can form something called as extended spectrum beta lactamases. So they destroy the penicillins and carbapenems that you give, right? So Klebsiella creates these extended spectrum beta lactamases. These destroy penicillin and sporosporins. Even worse, there's a carbapenem resistant Klebsiella also. This is a major hospital problem worldwide. You get Klebsiella pneumonia carbapenemase, right? Now that's how you know which antibiotics to give. That is something, okay, so if I study the ABCs of Klebsiella, there's aspiration pneumonia, there's abscesses in the lungs and liver, there's current jelly sputum, mucoid colony is very important. just jumping there for you to remember, and they're wondering polysaccharide capsules. Then diabetes, always the diabetes or alcoholic patient who have decreased gag reflex. And then ETOH is basically alcohol abuse, right? So Klebsiella, think about the capsule, think about the lobar pneumonia, think about the alcohol abuse, the sticky mucoid colonies, and blood current jelly sputum. A classic vignette would be like a 58-year-old alcoholic man presenting with fever, productive cough, and thick red current jelly sputum. Chest X-ray shows right upper lobe consolidation. Most likely organism is Klebsiella pneumoniae. So I'll stop the video here and I'll continue with the next bacteria in the next video.